Hello, and thank you for joining us. My name is Karen Zingle, and I'm here today with Dr. Gillian Adams, family medicine physician at MedStar Medical Group in Alexandria. Thank you so much for being here today. I'm so excited for this Facebook Live chat. How are you doing today?
I'm great. I'm really excited to be here.
Good. Well, welcome to MedStar.
Thanks.
So we are kicking off Mental Health Awareness Month in May. So today we're going to be talking about adolescent behavioral and mental health disorders. So before we get started, Dr. Adams, can you just tell our audience a little bit about yourself?
Sure, I'd be happy to. So I'm a family doctor. A lot of people don't know what a family doctor is. It means I did a residency in family medicine. I treat all ages. I see newborns, I go to nursing homes, and I do everything in between. So I'm someone that can follow patients throughout their lives. And I do have a kind of special interest in treating mental health disorders. I've been very interested ever since my residency in treating depression, anxiety, ADD, ADHD, and I am very, I have a certain expertise in it. I give talks to other doctors about how to treat this in primary care, and also I've given talks on the national level at different conferences.
Thank you. That's very impressive. Yeah, we're so excited to have you here. So let's get started with some questions. We're going to focus right now on adolescent behavioral and mental health disorders.
Okay.
So as we know, today adolescents face many more challenges than ever before, starting with regular social pressures that have always existed, and now we're adding technology into the mix, like social media. Adolescents are exposed to more, and parents are oftentimes unaware of the social pressures, and technology seems, to exacerbate that. So let's talk a little bit about some of the warning signs. What are the warning signs that parents should look for in their adolescence? Signs of depression or anxiety or stress?
So adolescent angst is very difficult to differentiate from depression or anxiety. Sometimes when your teenager comes home and seems sad or seems kind of unhappy with their social situation or wants to complain, seems a bit irritable, you may think, oh, they're depressed. But actually, it's normal. Adolescence is a very pivotal time. It's where kids are, or people are, developing insight into themselves, the ability to make choices on their own, the ability to kind of orchestrate their own lives, and it's a time of great learning. Even when I have had times in my practice where I wasn't seeing new patients, I would always see adolescents because I thought it was such an important time for them to have someone that they could confide in and be able to figure out who they are. So the classic symptoms and signs of depression are the same for childhood, adolescents, and adults, which are trouble sleeping, either falling asleep or staying asleep, not being interested in things that you're usually interested in. I used to love to play softball, and now I don't. The two cardinal symptoms are either feeling very sad or very anxious most of the time, which in adolescence often is manifested as irritability. And all adolescents are irritable, but this is all the time. And then they can be negative, but this is more, every day is more negative. And what happened to my kid? They used to love to play softball, used to be on the debate team, and now really doesn't want to do that. Feeling guilty or self-doubts. I'm stupid. I'm just not as good as the other kids. Having low energy. And so this is a classic one where people complain about their adolescence. Oh, they go to bed late and then they wake up late, but they have normal energy for other times of the day, as opposed to with depression where they're tired all the time. I'll have teenagers who don't want to get out of bed the whole weekend, or they used to love to go for a sleepover at a good friend's, and now they really could care less. And then, of course, some risk-taking behavior. I always say that our main job in life is to help our children love themselves. If you feel good inside yourself, you're less likely to try drugs, to have sex because you want to be liked or popular. If you feel good, then you tend to not engage in as much risk-taking behavior. So there's some. Is that enough?
Yeah, that's perfect.
Awesome.
What you talked a lot about the differences between normal stresses and cause for concern. At what point should a parent contact a physician for additional support?
Well, I think it's important to look at how your child is functioning normally in his or her life. If grades are good, a lot of parents say, oh, well, the grades are fine, so I really don't have anything to worry about. But if your kid just doesn't seem like, let's say herself, if they're not, the kid that I knew before, or also not acting like a lot of peers their age in terms of just, kind of normal, healthy function, then you want to just run it by the physician. So as a family doctor, I'm central dispatch. You bring your problem to me, and I can help you negotiate the path and which way you want to go. Do you need to see, if it's a child, do you need to see a therapist? Or maybe we should just work on exercise and sleep and healthy habits. But I think if you look at what is the normal function, or are there barriers to my adolescent leading a meaningful life? Are there things that they want to do or they used to like to do that they're not doing anymore? Then you want to seek some help and just talk about it. When you go to the doctor, it doesn't mean you're going to be slammed on a medicine or sent into intensive psychotherapy. Those may be useful, but it's more just to talk and to see what could help at this point in time help them feel well going through this year.
Right. Great.
Oh, I wanted to say something about social media. So there's a lot of controversy in parents about, like, when do you get your kid a cell phone, and is it even a good idea? And I do want to put a plug in for making a contract with your child when you get them a cell phone about the appropriate use, setting appropriate limits with use. It's recommended by the American Academy of Pediatrics and Family Practice to not have more than 1 to 2 hours of screen time, any screen, iPad, iPhone, computer, TV, a day. And also there's no screen time at night. When initially you get a phone for your child, whether it's at age, well, there's kind of a consensus then when your child is going to be without you. There are times where they'll need to contact you for safety reasons. That's a good time. But you see a lot of kids 7 and 8 with cell phones. They should put those phones in the kitchen or in a safe place at night, no screen time at night, and the parents should have access. You don't get privacy with social media at age 8. and so, like I said, you can Google, and I know I have resources of good contracts you make with your child.
Right.
Social media can create more anxiety and depression than not. When I was a child and I was friends with two girls and they went to the mall without me, I didn't know. Now I'm with Julie at the mall and we're having such a good time. And I think as a child, oh, they're leaving me out.
Right.
Oh, this is awful. Why didn't they call me?
Right.
And so actually, like Facebook, social media, Instagram, Snapchat, can make children and adults feel more isolated. So I think that's really, I wanted to bring that up.
No, thank you. That's really helpful. Very good. Let's talk a little bit more about fatigue.
Okay.
So talking about normal fatigue versus causing for concern. Are we talking about someone an adolescent child who's sleeping in until 2 in the afternoon? Is that cause for concern, or is that normal behavior?
So your sleep-wake cycle changes as you get older, and you know that young children often get up really early and go to bed really early. But around puberty, it changes, and they want to go to sleep later and wake up later, which totally doesn't work for high school, but it's just the way it is. Actually, there have been studies where they started high school later, as opposed to like the 7 o'clock, more 9, and kids perform better on standardized tests, and there was less absenteeism and less fighting in school. So it's normal for your child to want to go to bed later and wake up later. It's not normal to sleep all day and not want to do things, and also to be always tired. There's a concept called emotional exhaustion. When you get enough sleep and you are trying to get some exercise and you're making it through school, yet you always feel tired. It's true for us too. When I have patients who come in who have anxiety or depression, and they say, I'm always tired. I can get 8 hours of sleep and I'm getting my exercise, but every day I just think, when can I get back in bed? So that's the kind of exhaustion or fatigue you have with depression and anxiety. You never feel completely well rested. Also, with both depression and anxiety, one of the cardinal symptoms is having trouble either falling asleep or staying asleep. So taking too long to fall asleep, or if you wake up not being able to get back to sleep for a half hour, an hour. And of course that makes you feel tired during the day. So that's another reason that people with depression often have fatigue.
Okay, Thank you. All right, well, let's shift to ADHD. So we hear so much about ADHD or attention deficit disorder. What are the early warning signs of ADHD?
Well, warning signs is an interesting question. So ADD, ADHD, so attention deficit hyperactivity disorder and attention deficit disorder are hardwired. It's not, they don't come from something. It's the way you're wired. They often runs in the family. And it's 5 to 9% of the population of kids and adolescents, and 4% of the population of adults. And that it does last into adulthood, but often the ADHD goes away, the hyperactivity, the fidgetiness, and the distraction persists. So adults are less likely to be, jumping up and down and climbing on the furniture, but they will say, I can't attend to things. I get very distracted when I'm in a meeting, etc. So things, I know there's a big concern about people wanting to medicate kids just to make them be good in the classroom. But it's not, no teacher wants to, or I think very few teachers, if any, want to put children on medicine to control them. They want to have ADD, ADHD treated so that child can function well and can have good self-esteem. When you look at a class of 30 kids, maybe 4 or 5 are treated for ADD, ADHD. So what you look for are inability to sit still, not just being active. It makes me a little crazy when people say, oh, I'm really energetic, I have ADD. You don't have ADD, you have energy. It's totally different. So often inability to settle, inability to listen, not retaining information, forgetting what the homework was. It's not that they don't want to do homework. Kids love to get approval. They love to do well and get the gold star. If they're not, there's an impediment to that. They are having trouble where they try and they're not remembering, and so they don't do well on things, and then they shut down and say, I'm just stupid. So it's trouble losing things, forgetting things, inability to complete things, poor organization, unable to be redirected. If you have the little boy that's jumping up and down and you say, John, you better sit down, he's going to sit down and he's going to want to get that approval from his teacher unless he's physically incapable. And then he keeps getting up and running around. It's not because he's trying to antagonize her. It's because he can't do it. There's a really good book by Raimondo is one of the last names. It's called You Mean I'm Not Lazy, Stupid, or Crazy? And so many parents bring kids in and say, he's just lazy. He doesn't want to work. And really? I mean, they're not lazy. Kids are very approval driven, but if they can't do it, they tend to just shut down and not want to try. And that's our job to see that and to say, how can I help you feel better about where you are and be successful?
At what age would you be diagnosed with ADHD?
So ADHD is generally diagnosed before age 7. But sometimes, especially in girls who, she's getting good grades and she's so sweet, she's just in la la land sometimes. They miss it. But still, girls are going to have some of the same things as boys, which are, not, I forgot to turn in those papers, I forgot to do that, and unable to absorb what they're learning in a class. So generally, with the diagnosis of ADD, ADHD, you want the symptoms to have been there before age 7.
Okay. And how is it diagnosed? Is there...
it's multifactorial. Okay. So you want to talk to teachers who have been... the symptoms, whereas with depression and anxiety, you need the symptoms to have been evident for at least 2 weeks. It's usually way longer than that. But in the past 2 weeks, have you felt down, more than okay, etc.? It needs to be at least 6 months with ADD, ADHD. And you could bring the teachers in, their parents' rating scales and their children's rating scales. We often do some neuropsychiatric testing because you want to make sure there's no learning disability, which makes it hard to read or do math. There's no sleep disorder. There's no metabolic disorder. Certainly in the past we saw a fair amount of lead poisoning and things like that, hypothyroid. But usually when you evaluate ADD, it's pretty rare that you find anything in the blood work, but you always check everything at the beginning. So you get parents, there's a rating scale, the Connors rating scale we've used for 30 years. So parents fill it out, teachers fill it out, and then when they're old enough, the kids fill them out. And then we use that to reassess each time.
Okay, great. And what about treatment options? What treatment options?
So with depression, anxiety, ADD, with children, you always start with behavior therapy or cognitive behavior therapy. It doesn't make any sense to just put a kid on medication. It's just not the way it's done. And they don't learn enough in terms of coping skills and how to identify how they're feeling. One thing I wanted to say before, with kids in depression, they say things instead of like, I'm feeling depressed, I'm not feeling at the top of my emotional game, you know, when they're 6. Things like, I don't enjoy anything, I was restless all day, I'm no good, I cry a lot, I hate myself, I'm irritable all the time, I'm lonely. So that's how kids present with depression and anxiety. So you start out with a good therapist, and it's really important that your doctor knows good therapists to refer you to, if at all possible. And you should feel comfortable going to that person. But then we do have very good medications that work very well and will cause no long-term side effects. I think it's sad sometimes when people are incredibly anti-medication to the detriment of the child or adolescent being in control of their problems and not being able to be their true selves. Right. If you're feeling sad, anxious, not sleeping, feeling bad about yourself, irritable. I've had kids, I hate everybody, they're all stupid, I hate school. And then we go through counseling, and then I put them on medicine, and they come back and they like school, and they're feeling better about themselves. The world is brighter and more open. Right. And if you've tried all the other things, resetting those neurotransmitters, serotonin, norepinephrine, dopamine, so that the symptoms of depression, anxiety, and then ADD with other medicine goes away, the kids are now able to live a fulfilling life. Right. And another thing about medication is once you start, it doesn't mean you have to take it for the rest of your life. This is a big fear. And when you, the first time someone's treated for depression, they should be treated for 1 year to remission, or at least 6 months, but 1 year is better, which means no signs or symptoms, like feeling normal for you. And then 50% of people will never need medicine again. ADD is different. ADHD is more common before the teenage years, and then ADD after. And through exercise, sleep regulation, eating healthily, and behavioral therapy, where you learn how to identify, okay, I need to do things the same time each day. I put my keys in the same place. Right. When I leave my class, I'm going to go through and look at my folder and do this. You learn how to schedule your life. Then a fair number of people won't need medicine. But if they're trying and they're like, I'm so frustrated, I'm trying everything, but I just can't reach my goals, I'm still, not remembering, then just to make their lives easier, clearer, medication can be extended as long as it is helpful.
Okay, thank you.
You're
Very helpful information. So let's talk a little bit about the coordinated care approach that you guys have here at MedStar Medical Group. Okay. What does that mean for patients and their families?
So I think a lot of people, one of the main things that we do as family doctors and internists is we help people negotiate the pathway of medicine. You may have a stomach ache and think, I should go to a gastroenterologist. That may be true, but you may want to start here, and we can look at what it obviously it is or isn't. Do you have reflux? Do you have lactose intolerance? And then I can help them get to the specialist that will serve them best. With depression and anxiety, you bring your teenager into me. I will establish trust and make it so they can confide in me and tell me what's going on in their lives, and have a safe place to be honest and explain what they're concerned about, because all teenagers are concerned about something. Then if I see that they may have a medical problem, like say allergies or insomnia or sleep apnea, I can go down that route and make sure that that is a non-issue. And then if they persist with having the symptoms of depression, anxiety, get them to the therapist. And then I talk to the therapist. I want to know how it's going when they come in. How's it going in counseling? What are you learning? Are you feeling better? And ask them those questions I was explaining earlier. Sleep, doing things you're interested in, feeling guilty, normal energy, and assess each time whether they're improving. And then if needed, I can be the one to initiate medicine. Or if they have more moderate to severe depression, anxiety, ADD, get them to a good psychiatrist. But still be here as a constant in their lives where they can come back year after year. And I can help them with the depression or the stomach pain or the hypertension later or the gallbladder that needs to be removed. So it's good to have like central dispatch where we have everything from all the specialists and can also help when there's a problem, know who is the best to see.
Okay, well thank you. That's all the questions we have for today. I sure learned a lot. I hope you guys did as well. So thank you, Dr. Adams. I really appreciate your time, and thank you guys for tuning in. If you have any additional questions for Dr. Adams or would like to make an appointment, visit our comment section. Thank you.
Great.
Have a great
Thank
day.
you.